Folks, Nick the Nurse here. Today we're going to be talking about some of the nursing diagnoses associated with the nursing problem of myocardial infarction, or an MI, classic heart attack. One of the big things that you might see or need to know for your patient on the NCLEX or on your nursing school exams is acute pain. So you want to anticipate that the patient will be in pain, or if you see that the patient is in pain, make sure that you develop a plan of care to get them out of pain, because we don't want your patient to be in pain. Why? Because being in pain sucks. That's the truth. And we want to make sure that your patient is not in pain. We also want to make sure that we address any fear. Patients who have heart attacks or MIs oftentimes are fearful, so we want to address that in a care plan. Activity intolerance. Recall when we talked about our nursing interventions for a patient who has developed an MI, we want to conserve myocardial oxygen demand. For that reason, we want to make sure that we do so by acknowledging they might have activity intolerance. So put that into your plan of care as well. They might have some anxiety. They might have ineffective health maintenance. Obviously, a lot of risk factors for developing an MI are modifiable, such as high cholesterol, smoking, stuff like that. Excuse me. So we want to make sure that we look at some of those when putting a plan of care together for the patient with MI. They might also have decreased cardiac output, so we might want to look at a drug regimen or other nursing interventions when we're putting a plan of care together for decreased cardiac output. Patient also might have anxiety. I know if I had a heart attack, God forbid, I would be pretty anxious because there's a fear of death, and anxiety is certainly something that we want to address in the patient so that they can go to being whole again. Again, my name is Nick the Nurse. I want to thank you for watching my video today. Check out my other videos at www.nickthenurse.com. They are completely free, no obligation, no money down. Just kidding. You don't have to pay anything. They're completely free. Check them out. Again, nickthenurse.com. Thank you for watching today. We'll see you next time.